Welcome back. It's Wednesday and we're keeping an eye on your health. I got Dr. Bose. He's not only a veteran but a PTSD expert. He's spoken on this nationwide, and that's kind of today's topic with 4th of July right around the corner. It's oftentimes a trigger. Let's talk about PTSD.
Yeah, there are many veterans in this area, and it's not just about veterans. It's about anyone who goes through a life-threatening or a perceived life-threatening event. Any major trauma, a trauma center like this, we see this a lot. We have to remember that whenever there's abrasions on your body, bruises on your body from a trauma, even after we treat those, there can be mental abrasions, the invisible wounds, okay? And this is important. It's not, we can't ignore this. In veterans, for example, if you look at the statistic, there is almost one veteran committing suicide every single hour. So about 22 a day. And, for the veterans coming back from combat, the recent RAND studies suggest about a 1 in 5 incidence of PTSD. So 1 out of every 5 of those soldiers will have PTSD.
It's alarming.
It's tricky. And we see this in our patients who aren't veterans. And as we look at our medical, capabilities today, for instance, if you have a heart attack, I can look at this EKG and see that you're having a heart attack. I can look at a blood test and see that you're having a heart attack. However, when you look at a brain scan, you can't see PTSD. It's an invisible wound, okay? It's not going to show up here. So we need to catch this by being aware of the symptoms. And the symptoms fall into 3 categories, okay? The first is reliving. So you relive the incidents of that trauma. For a soldier, that may be hallucinations or seeing the combat zone. For someone who is in a trauma here, a car accident or any sort of assault, they relive that. And then the second is arousal. So many soldiers, when they come back from combat, they're just more excitable. You'll see soldiers that you drop a can of soda on the ground and they jump.
React.
Yeah, so you have to be, recognizing those symptoms. And the final symptom is avoidance. And this is the most dangerous symptom because it's hard to catch. And this is that person avoiding things they normally like to do, activities, people. They detach themselves. And if you don't recognize this, this does often lead to people hurting themselves and getting really, really depressed. So
how do you treat that?
So there are many treatments, everything from cognitive behavioral therapy to, and without getting into the intricacies of the medicines and the treatments, I think the message for the public is, you can't see this, it's not obvious, and we as the physicians may not be the first ones to recognize these symptoms. It's you guys as the family members of someone who's been through a trauma. So, after we treat their bruises, their cuts, their injuries, the battle continues and they have to keep, fighting their mental abrasions and the struggles they're having from within, from that traumatic moment. This is something that the family members have to recognize so that we can get them the help to get them unstuck from that moment that they keep visualizing over and over again. So it's a real entity, it needs to be taken care of, and we as a society need to do a better job.
Absolutely. Dr. Bose, thank you so much. We're going to take a break. We'll be right back.